Hi friends, I am Dr. B.V. Rao of Usha Clinic and founder of the websites qmedicaldoubts.blogspot.com and raghavamedicaldoubts.com. Through these videos, I am providing the basic knowledge about the commonly occurring diseases, treatment and surgery details when necessary for the medical knowledge to general people and for reference to medicos. Today I am going to discuss about the angina pectoris, precursor of myocardial infarction. Angina is a type of chest pain caused by reduced blood supply to the heart muscle. Angina is a symptom of coronary artery disease. It is a recurring pain characterized by the sudden squeezing pressure, tightness, heaviness or pain. It is difficult to distinguish from the other types of chest pain like gastric pain, eosinophilia pain, etc. Causes. The most common cause is the coronary artery disease. Narrowing of the coronary arteries due to atherosclerosis may be secondary to the cholesterol or smoking habit. So, nutrition and oxygen supply to the heart is depleted, which causes pain during exertion. Types. Stable angina. When the heart demands more oxygen like exertion as in climbing stairs, exercise, low temperature, stress, heavy meals, smoking, etc. can trigger angina. It can be relieved by rest and conventional medicines. Unstable angina. It is a dangerous condition and requires immediate medical help. The onset is sudden and due to clot blocking the artery partially or completely. If blocked completely, may cause a heart attack. Variant angina. It usually affects during rest but is severe. It is caused by the spasm in coronary artery and when spasm is relieved, the pain is relieved. It is also called Prinzmetz-Bettel's angina. It is safer than the other two types. Symptoms. Pain in the chest, shoulder, hands, neck, jaw due to the referred pain caused by the nerve stimulation. Nausea caused as is with any severe pain. Vomiting may be rare. Fatigue due to the overall reduced blood supply. Shortness of breath due to the altered blood supply to the lungs secondary to the angina. Giddiness due to the reduction of blood supply to the brain. Sweating due to the shock stage due to pain. Angina in women. It is presented in a different way, having complaints of abdominal pain, nausea, fatigue, shortness of breath. Also may have stabbing pain in chest, neck pain, jaw pain or back pain. So it is usually mistaken as other pain. Risk factors. The following are risk factors for the angina: smoking or using other forms of tobacco, obesity, cholesterol, hypertension, diabetes, lack of exercise, old age, genetic causes and stress. Diagnosis. Besides physical examination, history, etc., some investigations may be required. They are ECG. For angina, it may not be diagnostic, but if it is approaching to the complete block, it is identified. Treadmill test to find the condition of the heart during exercise. Echocardiogram. It uses the sound waves to identify angina related problems and form images to be identified. Nuclear stress test. Here a radioactive material is injected into the blood and a stress test is conducted. It reveals spots where the substance is less and say here the blood supply is less. Chest X-ray reveals if other chest problems are present. Blood test. Here heart muscle when damaged due to the ischemia may leak some heart enzymes. Tests done to identify these enzymes to diagnose heart attack. Coronary angiography. It is done by cardiac catheterization. A dye is injected into the blood of heart vessels. A specific ray X-ray machine takes a series of X-rays. Cardiac CT scan. An X-ray tube present inside the machine rotates around the patient and takes images in the heart and chest. Cardiac MRI. It produces detailed images of the heart structures and its blood vessels. Treatment includes lifestyle changes, medication and manipulations. Lifestyle changes include to avoid active and passive smoking and use of tobacco in other forms. Obesity and diabetes is controlled by diet restriction and modification and doing exercises. Stress and strain are to be controlled as far as possible. Avoid large meals. Take food with whole grains, fruits and vegetables. Avoid structured fats. Medication. Nitrates, nitroglycerides, glycerin tablets are used keeping under the tongue. Aspirin. Aspirin helps for a free passage of blood in the vessels. Clot prevention. Preventing drugs like clopidogrel, prasugrel and triacylgrilor prevent formation of clots and block. Beta blockers helps relaxing of the heart and blood vessels muscles and allow free passage of blood. Statins help to reduce the cholesterol by preventing the formation of cholesterol. Reabsorption of cholesterol from the plaque of the vessels also have many benefits to the heart. Calcium channel blockers relaxes and widens the blood vessels of the heart. Ranolazine. It can be used with good results to the heart. Medical procedures and surgery. Angioplasty and stenting, also called percutaneous coronary intervention. A minute balloon is introduced into the coronary artery, inflated, and a stent is inserted into the artery to keep it opened. Coronary artery bypass surgery. A small piece of vein is dissected from somewhere in the patient's body like arm, thigh and used to bypass the block. That's all about the angina pectoris and management, and in the next video I will discuss about some other disease. Thank you.